Good afternoon, everyone. Welcome back to Mental Health Colorado's Legislative Lunch Break webinar series. Where we share biweekly updates on what's happening at the Colorado State Capitol and how you can get involved. Today is April 24th. My name is Ashley Perales, and I'll be your host. The Q&A feature is live, so if you have any questions, just let us know, and we'll do our best to answer them. And with that, I will pass it to Vincent and Wendy.
Hi, welcome back, folks, or welcome for the first time. I'm Vincent Atchity. I'm the president and CEO of Mental Health Colorado.
Good afternoon. My name's Wendy Buxton Andrade, and I'm the Vice President of Government Affairs, and we have survived almost another session.
Yeah, so just by way of orientation, we are a nonprofit, nonpartisan advocacy and communications organization working to promote healthier minds across the lifespan and to remind people that mental health is something we've all got in common. From one end of our lives to another, we've got all kinds of upsides to our mental health and all kinds of potential vulnerabilities and susceptibilities to setbacks that can become grave or chronic depending on how quickly we recognize our needs and are able to access the supports and services we need to thrive. So just to summarize some of our work, our priority bill this session has been Senate Bill 060, Young Youth Athletic Coach Mental Health Education. As you've heard us discuss before, anyone who's joined us, this is in our focus area of Strong Start for All Children, and what we aim to do is draw attention to the important intersection of young people's athletic engagement with its implications for better and worse for their mental health, and to do some protective things to make sure that it's for the better in more cases than not. Wendy, do you want to say a little bit more about what this bill does and what its stage is?
This bill joins together the concussion protocol that's already in statute, and it brings in the mental health training that most all of the youth sports already do. And it marriages those together. It brings awareness to the coaches as well as parents or guardians that a child after a concussion can go through a mental health crisis. This bill is something that basically is being done, but we've added a aspect to it to make sure that awareness is there between the coaches and the parents or guardians, and making sure that basically a village raises a child to make sure that everybody's aware of their mental health and how we can give them supports. So we are headed to the governor's desk right now. We have come out of both Health and Human Services on the Senate side, House side, as well as both floors, and it is headed to the governor's desk, and we hopefully it will become law at the end of May.
Just to add, our world of advocacy does not begin or end at the Capitol. It's about the public communications that raise Coloradans' awareness of important intersection points for their greater health of mind. And our communications and education work around this bill will be ongoing. I think that we've all had experiences of, well, most of us have had some experiences of both kinds of coaching, to generalize and divide things into two camps. There is the kind of great coaching that is the stuff of legend and popular culture, that is so supportive of young people's ability not only to perform in their chosen field, but also to excel at teamwork and sportsmanship, and develop all kinds of personal strengths and resilience that sustain them well beyond their athletic endeavors. And then there's, of course, also that kind of toxic culture, which really brings out the worst in people and creates an atmosphere of bullying and has kids experiencing all kinds of negative consequences and effects on their self-esteem due to a unhealthful environment. What we aim to do is bring to the fore people's readiness to recognize the red flags for what toxic coaching can look like, and to underscore and support all of the green flags around that kind of great coaching that makes our athletic world go round and keeps our eyes of great interest and support on the amazing things that young people do as athletes.
And this bill, actually, we worked very hard to make sure that we encompassed what was already happening with the concussion and mental health. So it was not an added burden on any youth's athletes and their training protocols. So we are very excited that this partnership that we have formed with a lot of different youth athletes and mentors has come together, and we'll see how quick we can get it through at the governor's desk.
Just to report on House Bill 1195, we've mentioned this in previous weeks. This is one of the several bills that have been introduced that are related to artificial intelligence and the efforts of lawmakers to try and put some protective guardrails around a technology that is developing more quickly than most humans can keep up with. This one is pretty narrowly focused on our world of access to healthcare, housing supports, and services, insofar as it aims to restrict the use of artificial intelligence in healthcare settings to sorts of more back office functions, and prohibits the presentation of AI as a direct service therapist to people, so that people are not being treated or cared for by a machine that is designed to do neither of those things, but rather to optimize the profits of the corporations that have invented those machines. So this has made its way through the House and is on its way to the Senate's Health and Human Services Committee.
And we are still waiting for it to be scheduled in the Senate Health and Human Services. And, this is one of the bills that we partner with providers and consumers to make sure that everybody's, their perspective is seen on this bill. And we think that this will help with the system and making sure that it's most efficiently used like it is supposed to.
The next bill we'll mention is around reducing the potential harm from drugs and alcohol, and this is Senate Bill 6, Parity for Non-Opioid Pain Management Drugs. And this is a important next step in trying to manage the ongoing opioid epidemic by making the sorts of medicines that manage pain effectively as available to consumers as the opioids themselves have been, so that people are not just automatically steered toward the more addictive substances when less addictive but equally effective pain management substances are available to them. This has also made its way through the Senate and is on its way to the House.
This bill, you'd think in today's society that this bill was a common sense. We hear about opioid pain management and how addictive. This is one that actually we heard from doctors that talked about having a hard time trying to get non-opioid pain management drugs for their patients when it was requested or they saw that it was fit. So this will make it easier for everybody to receive non-opioid pain management as we tend to, know that opioids are good when they're controlled, but they also have created a epidemic that has hurt our society too.
Um, we forgot to change the title on this one. This is Senate Bill 149. We took an amend position on this bill, which has been sort of nicknamed informally a competency bill. This has made its way through the Senate with many other allied advocacy organizations also in an amend position, doing what we have thought of as sort of harm mitigation to ensure that this bill does not overstep regarding people's civil liberties. As it happens, it has something like 50 amendments attached to it, addressing those concerns and also ensuring that there be some gathering of data out of how this bill is implemented over months to come so that it can be revisited next year and probably the year after that. The fiscal note attached to this bill for its first year of implementation is somewhere around $30 million. And then the expectation that it may be $10 million per year going forward after that. The hope of the bill is that it may do something meaningful to stem the tide and reduce the competency backlog. But I think that we are concerned that it may not bear the fruit that is anticipated, and that the state will continue to pay the $10 to $11 million in fines that it has been paying for past many years due to the state's inability to meet the terms of the federal consent decree. So the bill is a mixed bag, and I think that one of the things that we can feel most positively about it is that it has kept this topic in the spotlight for state leadership. And that's really important because the individuals whose lives hang in the uncomfortable balance in the course of this competency backlog experience are exactly the individuals who are most likely to be out of sight and out of mind from the public eye, since they are literally locked away in jail while their health needs go unaddressed. So every effort to keep these individuals' plight in the public eye and in the spotlight of state leadership is a valuable effort. And we thank the bill sponsors for having not lost sight of this too easily forgotten population.
I just want to say thank you to all the senators and House of Representatives that have worked on this. It's been nonstop. The, DAs, the public defenders. I mean, everybody has been at the table working on this and trying to find a solution. And admitting that they don't know exactly what the solution is, but this is a path in the right direction of trying to correct some of this. But this is not, a partisan bill. This is bipartisan people working together on both sides of the aisles to make a difference for those that are caught in the system.
We don't take opposed positions on a lot of bills in any given year, but invariably there are always a few that we have to take an opposed position on. Senate Bill 112, court actions related to failure to appear in court, would have increased the incarceration of people whose primary condition is being unhoused, having unmet health needs, experience prolonged indigence and poverty. This was not a great bill for all those reasons. As it happens already, maybe you don't know this, but the majority of individuals held in jails tend to be individuals who are being held for failures to appear in court. So these are administrative holds on individuals. Being jailed is extremely disruptive to people's lives and to their health. And our sort of national tendency to restrict people's liberty in this criminalized kind of way is a terrible habit and practice that we've fallen into. This bill would have extended that, but the good news is that it died. It did not make it out of the Senate, so we opposed it. Mission accomplished.
Any additional thoughts on that, Wendy?
No, it lost on the Senate floor. It made it through committee, actually made it to the Senate floor. So, and it lost on the Senate floor, and that was a good thing because it is no longer in action anymore, and we opposed it from the start.
Another one we opposed is House Bill 1285, and this was going to restrict people's admission to a mental health residential facility based on their past justice involvement tied to a sex offense. This was going to create a hurdle and a barrier for people's access to care. Access to care needs to be determined by people's medical needs, not by their position within the eyes of the public. The facts of the matter is that residential location of individuals who've been adjudicated as a sex offender has very little correlation to recurring offense. And people who are feeling protective about sex offense ought to know that something like 90% of these offenses are by known individuals within people's families or circles of close proximity, not by strangers. So be protective within your family and within your family circles, and a little bit less alarmed about the stranger out there who's complied with all of the terms of a judicial process. This bill was postponed indefinitely, which basically means it dead in the water. It was withdrawn early in the process.
And this, we sat during testimony of this bill, and one of the things that the data supported this being postponed indefinitely because there was a lot of misperceptions that happen. And we see that a lot with different bills that are brought. They think it's going to solve the problem, and actually, the local perceptions are misguided. And this is one of the bills that definitely had a lot of misguiding.
So just to recap, a number of the bills we've been following and championing this session are all on their way or sitting on the governor's desk awaiting his signing. We mentioned Senate Bill 60. We've talked about House Bill 1024, which raises the age of voluntary relinquishment of a child so that people can have up to 30 days to determine to take advantage of a safe haven drop off for a child for the sake of general health and well-being, which brings Colorado into closer alignment with many other states that have already extended that period. Colorado previously been 72 hours, which was not a good time frame for clear decision making. What else? House Bill 1039. Basically, Colorado established some jail standards a couple of years ago through the work of a Colorado Jail Standards Commission. Those jail standards initially included only the county jails. 1039 adds municipal jails to that oversight planning. What else? Let's see. House Bill 10 002, this is a bill about trying to ensure that there's some monitoring and of the ghost networks where um, it appears that there are many providers available to you within your plan, but the reality is that very few of them are actually taking new patients. This takes an important step to clearing that up, which is great for access to care. Uh, House Bill 1134, Fairness and Transparency in Municipal Court. This is steps toward bringing the kinds of sentencing that goes on in municipal courts into closer alignment with the way similar charges are sentenced, adjudicated, and sentenced in state courts. It's strange that we've got disparities across the state, but we do, and people should be aware of that. And then House Bill 1110 is protections for elders against the kinds of financial exploitation and fraud that can be extremely harmful to people as they advance in age and find themselves defenseless when it comes to being able to track how their money is being protected and spent. So the bills go to the governor's desk. The governor then has a choice. The governor can sign them into law, which is sort of like an extra vote of approval from the executive office, or the governor can allow them to become law in 30 days of sitting on his desk, or the governor can veto bills, and those vetoes can then be overridden through an additional process in both chambers. Our expectation is that these will either sit and become law or be signed and become law. Wendy, do you want to talk about these?
The use of prescription products with these have been signed already by the governor, and they have become law now. Their active date, most of them will come July of this year, July 1st, along with the as the fiscal year for the state comes around. So Senate Bill 31 has already been signed, as well as Senate Bill 14, and we we'll see how those all come through. They are now signed and will become law.
Oh, it looks
Right.
like the little screens with our faces is covering the date, but Friday, May 22nd is the date. But go ahead, Vincent, sorry.
I don't see anything covering there. Anyway, thanks, Ashley. So this has been our bi-weekly, every other week legislative update webinar. We are taking a break on May 8th. We will have a wrap-up webinar on May 22nd, and that will conclude that particular series. Just to say, if you want to continue to hold this time on your calendars for future weeks, we will follow up on this series with a series of podcast-like interviews with various voices for healthier minds from around the state of Colorado. We'd welcome your participation in those as well.
And just so you guys all know that a lot of times we talk about session happens in the 120 days. A lot of prep work happens in off sessions. A lot of networking happens. We are at a lot of different tables, and we will bring those to you as they come around and make sure that people are informed during the off sessions of maybe what's happening in different groups.
Thanks, Wendy. And that brings us to joining the Brainwave. If you haven't joined the Brainwave yet, this is a really good way to stay updated year round on what's happening in Colorado with health policy. You get action alerts, monthly updates, and opportunities to get involved. So please do sign up for the Brainwave if you haven't already. And you can also continue to review our legislative priorities on our website by following that QR code, or just visiting our website and going to the legislative priorities page. And then after session, we will produce our legislative report and scorecard, which will show how all of the legislators throughout session voted on our priority bills and updates about what happened in session. So we hope you will join the Brainwave and continue to follow our work.
Thank
And
you,
I want to
everybody, for being here with us. We've enjoyed this new segment of keeping you all informed.
Yeah, it's been fun. And thank you to the organizations that have sponsored our Brainwave and our webinars, Rocky Mountain Health Plans, Accessitree, and Johnson & Johnson. We really appreciate the community support, and that helps us do what we do. And if anybody has any questions, my email is aparalis@mentalhealthcolorado.org. Please do reach out, and we will respond to you. And with that, we will say goodbye. Thanks, everyone.
Thanks all.
Thank you.
Have a good weekend.